Welcome to the Cambridge Health Alliance Health is Well. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. Today we have a very important subject to talk about. We're talking about elder abuse. And we have with us Susan Pacheco, who is the Director of
the Cambridge Council on Aging.
The Cambridge Council on Aging, and Betsy Crimmins, who is an attorney
at Greater Boston Legal Services.
And we're going to talk about this very important subject. We have a coalition right here in Cambridge.
We do. It's called Cambridge Elder Abuse Prevention Coalition, which the two of you are members of. So I am very happy to be able to chair such a fine committee. Let me tell you a little bit how we got started and what we're currently doing and who the members are. About a year and a half ago, Greater Boston Legal Services came to us and said, wouldn't it be wonderful if we could come together and do something to prevent elder abuse and exploitation? And we all thought about it. Wouldn't that be great? It would be wonderful if we could eradicate elder abuse. In the ideal world, that's what we would want to have happen, but we know, unfortunately, that's not feasible. But if we can do as much prevention as possible, education,
mm-hmm.
That is truly what we can do. So that is really what our mission of the coalition is to educate and promote awareness of what elder abuse and exploitation is.
So let's share with the folks what it is. What is considered elder abuse?
Well, elder abuse, think about just all abuses in any of the life cycle, from children, disabled, battered women, all the way to elders. It follows the same symptoms and signs. What you want to be able to do is, if you're working with an elder, if you are, your neighbor is an elder, or whomever it is in your life that you're crossing paths with someone who's elderly, these are the things that you should look for. Think about, define abuse. It could be emotional. It could be physical. Mm-hmm. So emotional, of course, being, someone is, putting you down, like just verbally abusing you, name calling, controlling you in your, just your mind, your mental health.
In your everyday life?
Everyday life. Mm. Physical abuse is going to be more apparent. Right. You're going to see it. You're going to see bruises. You're going to see welts. You can see fractures. So that'll become more apparent.
I think that's pretty clear for us.
A lot of times, yes, because you can see it. But remember, when you think about when you see an elder, you might see bruising, you might see, broken bones, and you might think, oh, it's a normal part of aging. They may fall. It's medications, etc. It's not a normal part of aging. No. You want to make sure that you look at the entire picture of the elder's life. You want to make sure, do they have individuals in their home that shouldn't be there, for example? Are they in an intimate partner relationship that somehow, there's some physical violence? So the next step would also be verbal, as, very much like emotional, physical, verbal. So again, I previously said the name calling, and just like putting you down, just
very demeaning,
very much so. And then we have neglect. This is really one of the biggest ones that it becomes the most underreported situations under abuse of elders, because you have active neglect, and that could be more from a caregiver, someone who is in a role like perhaps an adult child who is living in the home caring for their adult relative, and
or supposed to be caring adult relative.
And so they are withholding medications, not taking care of specific life needs that basic necessities, keeping them from going to medical appointments, not transporting them to social occasions that they may have been part of, things like that. That is very much like active neglect. Then we have passive neglect, also by caregivers, but sometimes it could be because of an overwhelmed caregiver. It could be someone
Caregiving is very overwhelming.
It's more than a 24-hour job, as we know.
I took care of my mother.
Exactly.
I get it.
Exactly. So we know that when someone is, they're in good intentions, are trying to care for their older relative, but they perhaps don't know about resources. They don't know about the PACE program. They don't know about Somerville Cambridge Elder Service. They don't don't know about services being able to come into the home, they may be trying to do everything they can, but they're overwhelmed with it. Those are the easiest cases, because once you come in and investigate and are able to provide some support services, it really does work. And then we have neglect, again, passive neglect, self-neglect. And those are cases that we see a lot of. And that is very much an elder who perhaps isn't cognitively has started to decline and can no longer take care of their finances, can no longer take care of their personal care, isn't caring for their home environment. Perhaps they're leaving trash around, perhaps they're not eating proper, nutritious food. Maybe they're not taking their medications. They're not being med compliant or healthcare compliant, and that's mostly because of a cognitive decline. And those are usually the ones that become the most underreported situations, because you don't know what to do with those situations.
They tend to hide out those people.
They hide out.
We can't even find them.
Exactly.
That's right.
And those are those are very difficult. And then of course we have financial exploitation, which I know Betsy will touch upon, because that's really, seniors are, congratulations, prime targets, for all of the scam artists out there. And you can get called from the IRS. You can get called from, a jury. You can be subject to a grandparent scam. You get every call imaginable, whether it be a call or emails, etc. Because they know you're there. You could be isolated. You don't have as many social connections, and they know how to work you. So
And
they're going to
they hit home with the things that could tug at your heartstrings.
Exactly.
And I even heard of a funeral. I forget what they called it. I think a funeral scam, which was they would call and say your loved one who just passed away owed so much money.
And then
which I think is unconscionable.
We're talking about strangers exploiting elders financially. And then of course you have the financial exploitation done by family members. The adult child who, is either, withdrawing funds from a joint bank account, or even a non-joint bank account, not paying utilities or rents, and the elder may think that they're entrusting the funds to that adult child to take care of those things, and they're not being done, and then all of a sudden they have utility shut-off notices or eviction notices, etc. And that really is a result because the money is disappearing. And then one of the other types of abuse that we can't forget that happens in the elder population is sexual abuse. And I think that's also one that we probably don't think of elders as sexual beings, so we don't really think about that they could be also targets of sexual abuse. So you have to look for the signs. You have to look perhaps torn clothing, or bloody clothing, or stained clothing, or even just not feeling comfortable being around others, being very jittery, etc. So just remembering that's definitely a type of abuse as well. And in all situations,
do we see a lot of that?
There's actually, I can't speak to it directly, but if you speak to Protective Services, our local Protective Services is from Somerville Cambridge Elder Services. They have a great team of workers there. So if you ever suspect any type of abuse and neglect of an elder, you should call Somerville Cambridge Elder Services and speak to the on-call protective service worker, even if it's consulting, and then you can do more of a report. And I think it's important to stress that when we talk about protective services, it's very, very different from what we know of as child protective services. We always envision, like, if there's child abuse or a neglect, that the social workers come into the home and they yank out the child,
right,
and take them away from the parents. That isn't the case with elders. Elders have the right to self-determination. So they have the right to, if they're deemed competent, they have the right to decide.
I was talking about this morning.
Yeah.
They have a right to make a decision, even if it's a bad one.
Because we have the right to do that, We
Right.
have the right to do that. So just because they're considered to be a vulnerable population, we don't want to strip that right of theirs either. And they can really do, it can be a very stupid decision, and we as providers aren't agreeing with the decision, but we have to let it, we have to let it go, be there as support, provide as much information and resources as possible. And, just as we know with so many different situations, whether we're talking about individuals in, a domestic violence situation, or if someone has, abusing substances, etc., it may not take the first time, but if you keep providing information, there will be the day that they will take you up on it, and you'll be able to provide the resources.
Right.
So,
I know it is kind of frustrating in a way, because we want to run in there and fix it, make it all better for them.
Right.
We can't always.
Right. But I think it's been great with the coalition, members of the coalition, the Health Alliance, Greater Boston Legal Services, and their local Cambridge office, Cambridge and Somerville Legal Services. We have the police department, we have the Attorney General's office, we have Consumers Council, we have the Middlesex DA's office, we have Protective Services, we have domestic violence advocates at the table. And that is key, because for the first time, what is happening is we have both domestic violence advocates as well as elder service providers at the same table talking about the same subject. Because we have to remember that if a younger person is in a domestic violence relationship, that abuse is not going to end simply because they turn age 60. An abuser does not stop abusing when they turn 60.
Right.
Okay? So that violence will continue. So we have to remember these long-term relationships, and the cycle of abuse may very well be there, and it'll become even more dangerous because an elder is frailer. Right. So the same...
And cannot just get in a car maybe and leave.
Exactly. Right, exactly. So we have to remember that, for the first time they're, just being at the same table, it's great, because we have now formed these relationships, these alliances, that if someone comes in and is in a domestic violence situation, I can call over to Transition House and get one of their liaisons and come over to the senior center and meet with them and work with them. And vice versa, because they're finding also in the domestic violence side of things, a lot of the individuals that they're starting to work with are older women. And they want to know more about how better to serve older women. It wasn't the constituency that they were normally working with before. So it's great that we're no longer in these separate silos. We're able to work together, and it's great to know that if someone comes in, Betsy said it at the first initial meeting, and I always say it's because of Betsy. She said what she wanted to create with this coalition is that there should be no wrong door. And that's exactly what I think we've established is, so if someone comes to me who's under 60 and for whatever reason feels more comfortable coming to me and telling me what's going on, and I'm not going to say, hey, I'm sorry, you're under 60, I'm not going to work with you. But no, I'm going to listen to her and be able to say, let me refer you to someone, but actually then make that call, make that connection, and have that meeting happen. So I always say, and I think my staff is getting tired of hearing me say it, as well as the coalition members, I really like the warm handoff.
Oh, absolutely.
And it's we're not tired of that at all. So that's what I really try to encourage. So,
it passes the baton of trust.
Exactly. And it's been great. The coalition members are phenomenal, and just having, just the police presence and, their community just wanting to work more and being able to do all this preventive work that we've been doing, like just presentations in the community, and we're welcome to go out anywhere and talk about it. And just, if we can just get the message out to as many people as possible, if it may not be you, but maybe you'll share that information with someone that you know.
Exactly.
And I always say, when I'm in a group of seniors, like I'm talking about, violence in older adults, but listen to this. If you may have a grandchild, you may have a child that you suspect something's going on. And that has happened. People have come to me afterwards and said, I'm really worried about my granddaughter.
It raises the level of awareness.
Exactly.
One thing I do want to make sure that the folks know is that there is no shame involved here, because I know the older generation, we, and I said this in one of my presentations this morning, we were not taught to share things. We were, expressions like "don't air your dirty laundry" and "keep your chin up" and "pull yourself up by your bootstraps."
Right.
All those expressions are great, but when it comes to something as sensitive as this, we want to it's okay to share it with someone, and there's help out here.
Right.
We want to make
Absolutely.
sure that people
Absolutely.
know
Right.
that it's okay to talk about
Right.
it. And
Right.
you know, I know if it's someone close to their heart, it could be a grandchild, and then they don't want to say anything, they don't want to rock any boats, they don't want to make any waves. You know that
Right.
silence.
Exactly.
them.
Right.
Exactly.
And I think it's hard for people to talk about it for lots of reasons. One is just generational, like what you just referred to. The other is there's a real sad statistic, which is 90% of all elders know their perpetrator. It's someone they trust and know. It's usually an adult child, a grandchild, a niece, nephew, neighbor, friend. So fear of retaliation, fear of getting that person in trouble. Or I just even think about an 88-year-old who lives on his or her own and gets scammed. If it happened to me, I'd feel shame, embarrassment, anger, but I know I'd tell people because I'd want it to be sort of a
Right.
cautionary tale. But I think of somebody much older and what's at stake, what do they at least think is at stake for them? Oh, if I tell my kids, will they take my checkbook away? Will they put me in a nursing home? I mean, it rocks people's worlds in ways that I think it's hard for other people to understand. So it's easier to just keep it inside. But that takes a toll as
It
well.
does, because if it
Absolutely.
doesn't come out of your mouth, it'll come out of your body.
That
That's
is
exactly
true.
right.
That is true.
Right.
And we want to encourage, at the Council on Aging, we operate 2 senior centers. So we have one right in Central Square across from City Hall and the other one in North Cambridge at 2050 Mass Ave. We want to really encourage that the senior centers are safe places for seniors, that they're able to come in, they're able to, participate in activities, socialize. Because if we decrease the seniors' isolation at home, like by bringing them into the senior center, by participating in things, if there's something going on, they'll share it. They'll share it either with their friends or they'll come and seek assistance from, the staff. So that's what we really want to encourage, because the Council on Aging, we can really consider ourselves as, a very integral part of, the prevention and the awareness. Because if you're coming in, you may be coming in for a yoga class, but if we can interject some information on things,
Absolutely.
you could walk away knowing, hey, this isn't happening to me, but I'm really worried about my 88-year-old neighbor, who, et cetera.
Now that
So-
you've heard something, you might recognize
Yeah.
some of the signs.
Exactly.
Right.
Exactly.
Part of it's just raising awareness
Right.
and talking
Right.
about it, because as Susan said before, it's not child abuse. It's a much more complex issue in a way. If you had a 6-year-old, lots of people could say, get that child out of that situation,
Right.
but we can't and
Right.
shouldn't do that with an 86-year-old. And then when you take the whole family dynamic, for many years I would say it's a situation where a son or grandson has moved back into an apartment, somebody's about to be evicted. I'd say, great news, you can stay here. All you have to do is take out a restraining
Right.
order against your son.
Right.
And 10 out of 10 times the answer was no. And really it took me years to take a big step back and see what that dynamic was. And even if everyone's pointing at the adult child as the perpetrator, that's still her son or grandson or daughter.
Right.
And there's a relationship there none of us are privy to. There's all sorts of dynamics there. And, to be able to, what's great about a community coalition is to be able to bring services to both parties, regardless of what the perpetrator did. If he doesn't have housing, if he doesn't have income, and there's a way to get services to him as well, you might actually get the elder to then agree, yes,
Exactly.
good, I'll stay here because
Exactly.
he's going to be taken care of
Exactly.
as
But
well.
the perpetrator has to be receptive to this.
That's right.
Correct.
And the elder does
And the
too.
elder does too.
Right.
Right.
But I have seen,
Right.
multiple times people hitting the streets because they won't put a family member out.
Right.
Hey, listen, I've seen it myself. And at the PACE program, we've had some people ready to enroll. In fact, we did enroll one woman, and she went back. We could get her out of the home. And she went right back. It was her grandson, and she went right back to the situation because emotionally,
she
her
was-
heartstrings were pulling,
Yeah.
and she couldn't bear it. She felt like she was betraying.
And we have to recognize that.
Right, we
Yeah,
do,
we
we
do.
do. And I mean, I get it, I have 12
Right.
grandchildren. I understand that.
Right.
But, and I always say, there is no excuse for abuse.
That's exactly
There
right.
is no excuse for abuse.
Absolutely.
None. We
None.
certainly can live with each other and in community and deal with each other
Right.
without abusing each
Right.
other.
Yeah,
I hope I
exactly.
live to see that day.
Well, that's why I think the
Yeah.
community, doing it on the community level, to me, makes the most sense because it's where people live, it's where they work, it's where they shop, it's where they walk into Susan's senior center. So if anyone's going to know what's going on in this community, it's the two of you, it's members of faith communities here. I mean, I think about an older person who might leave the house 2 or 3 times a week. They get their hair cut, they go to church, and maybe they go food shopping. So if you can talk to stylists, if you can talk to members of faith communities, who might somebody actually open up to that they feel comfortable with? And it's not to tell professionals or even providers, you have to know all those symptoms of elder abuse that Susan talked about. It's rather, what's your gut here? If something doesn't feel right, that's as simple as it gets. You make a call to Protective. You don't even have to make a report. You can simply say, I'd like to talk through something that's going on with, one of my customers, or, we just had this great forum. We have a community coalition in Arlington as well. We had a great joint, it was a joint Cambridge-Arlington event where we had 40 bankers. So a lot of frontline people.
Oh, that's an important,
yes,
right,
absolutely.
frontline.
Unfortunately, elder financial exploitation is rampant. So having people who watch, say Mrs. Smith comes in every Wednesday and takes out $50. And now she's coming in with a young woman 3 times a week and taking out thousands at a time. Red flag. Or Mr. Jones is always impeccably dressed and now he's disheveled and confused. Red flag. What do you do about that? You start a conversation. That's all you do. And if something doesn't feel right, you can call Protective Services and make a report, hand it over to the warm handoff, and that's their job. And they're really skilled at going out and talking to somebody, not to get them in trouble, not even necessarily to get that other person in trouble, but rather, we're here to help. What's going on here? And like Susan said, I do a lot of outreach with Protective Services, and what they often say is, because providers get frustrated. Well, I called 3 times and they didn't do anything. And it's not that they didn't do anything, it's that it was an 86-year-old telling them, I'm good, walk away. But maybe it's the 8th time they go out and someone says, you know what, I really do want to talk to you about this situation.
Right. It's, it's all about relationship building.
Right, and trust.
Now, Betsy, is there any legal ramification here?
There can be legal ramifications depending on what the situation is. We have a case right now where it was an unknown scammer who knocked on our client's door and, long story short, defrauded her out of her home, ended up dropping her off at the Pine Street Inn. We had to file both a civil action and we made a referral to the Suffolk County District Attorney's Office, who arrested him. He's been arraigned and he ended up on the cover of the Globe. So there can be serious...
And did she get her home back?
She did not get her home back, but there was other restitution, or there will be other restitution.
So that home was gone?
That home was gone.
The home, the asset, the everything.
And everything in it but for the clothes on her back.
Right.
It was a really serious case. We had
And these things do happen.
We had another local one where it was the woman's son who had taken advantage of some of her medical limitations to have her sign the deed over. That's very common. And sometimes it takes...
Is it a cognitive?
In this case, it was a significant hearing limitation, so she was very reliant on her son to explain things to her, and he didn't. And a lot of times people don't find this out until years later. They go to get a tax abatement, or for some reason it becomes known to them that they don't own the house anymore. And they'll call our office and say, it can't possibly be true, and I'll just pull up the deed and say, oh, well, who's Jane Smith? That's my daughter. Oh, well, 4 years ago. And they didn't even know that this happened. And that is unfortunately, very common.
I had that happen with a neighbor across the street, and it was her son. Yeah. And his wife. And I was witnessing it. I said, let me help you. And she I could not help her. And so they lost the house. Right. Yeah. They lost the house. She lost the house to them. They were in debt way beyond their eyeballs. So they lost the house. The house was foreclosed upon.
Right. And that's your home. And for a lot of low income or even moderate income people, it's your only asset.
That's it.
Exactly.
And it's gone. Yeah. And you might be 60 years old and have several decades of life ahead, and where are you going?
Right.
So,
right.
And this is where public education and awareness, it doesn't have to be anything complex. Again, you don't have to understand the ins and outs of the legalities. It's just, this is your house. So if you want to transfer it to somebody, go get your own lawyer. Yeah.
Exactly.
Not another person's lawyer.
Let's just say, might it be an elder law attorney? Because Betsy is an elder law attorney, because the laws are so complex and they've changed and they
that's right.
continue to change. So I always say to people, please go to an elder law
Yes.
attorney.
Right.
Yep. Because there may be other ramifications. If you need long-term care mass health in the future and you've transferred your house,
Exactly.
there's that
The
5-year
estate
look-back
planning is
period.
Exactly.
Right. And you want someone who can cover every aspect of that. And even if it costs money to get that advice, think of
So
that
well
money
worth
it.
versus
A lot
your
less.
house. Right.
It's so well worth it.
Exactly.
Right.
Right.
I try to put that into perspective for people. So it might be a couple of hundred now versus a
Your
couple
home.
hundred
Thousands.
down the line.
Because once
Right.
you don't own your home, guess what? You can be evicted from your house.
You can.
You're not the
owner.
anymore.
You're squatting, basically.
And a lot of times that's how we get the case at Legal
Right.
Services. It comes in as an eviction, and we realize there's this whole backstory, but it happened so long ago we can't undo it.
And that's
So-
why this is so critical, doing this, the coalition, doing the prevention work, going out and speaking, educating the frontline staff at the senior center what to look for. Because, by the time it gets to Betsy and her partners, it's
deal's done.
already
It's a crisis.
So, yeah.
Right.
So
And
we-
housing, the local housing authorities are part of the
Oh,
coalition
absolutely.
as well,
Cambridge Housing
too.
is part of it as
Right,
well,
right.
because they, of course, have seen, great concerns with individuals, squatting in units,
Right.
or just elders befriending people on the street and having them come in. It doesn't even have to be someone that was a relative or anything. So, very much. There are many members that I've neglected to mention, but it's a great, robust coalition.
It
doing
takes a
lot-
village.
It takes a village.
That's
It
exactly
really,
right.
really does. It
Well, we
really
only
does.
have like 1 minute left, and this is such an important topic, and I there may be a whole lot more than what we've talked about, but I think maybe this has been a help to raise the awareness for folks, let them know that it exists, the
Right.
types of abuse,
Absolutely.
and how to recognize them, and most importantly that there's no shame or guilt or embarrassment.
Yes.
There's help out here for people. And I
Yes,
think
right.
that's what the most important thing that we can get out here. to
Absolutely.
people.
There is help
Absolutely.
available.
There is help.
Absolutely. Yeah.
There's lots of help, lots of resources, and we're all
Absolutely.
willing to help you. So thank you. I hope this was educational and informative for you. Certainly, I learn something new every time I do the show.
Thank you.
That's why we
Thank
do
you
the
for
show.
having us on, Roberta.
thank
Oh, my pleasure. Thank
And
you
for shining a light on this issue. Appreciate it.
Absolutely, absolutely. Thank you so much.
Great.